our addicts are not criminals. They're not bad people. They're not deviants. Our addicts are now patients when they have a disease. And a patient who requires treatment, hopefully before they've committed a criminal act, not punishment. Punishment doesn't work. And patients who are treated, especially in a hospital like ours, have rights to treatment and respect. And hopefully someday some insurance parity so that 90 days worth of treatment would be paid to the alcoholic or addict the same way open bypass cardiac surgery, bypass surgery is paid for. You know, the insurance company never says, you can't have this surgery because you went to McDonald's too much. Shame on you. No surgery for you. Like the soup Nazi, you know. No soup for you. Doctors are obliged to treat and protect patients. My obligation is to try to work against legislation which is going to reverse this back to the old punishment model. And, you know, our government has a record of the administration to administration sometimes forgetting that this is a disease that requires treatment and thinking that it's a behavior that requires punishment. So what happens here at the Betty Ford Center? Here in treatment we install new coping skills in the willing patient, and bring the cortex back online with principles. Sometimes newly instilled principles of the 12 steps, sometimes principles that they've lived with or grown up with and learned all of their lives and have forgotten. Coping strategies reset that pleasure set point back down to where pleasure and survival signals do not require dopamine surges that the drugs provided. They're back to where normal wonderful things cause a feeling of fulfillment and satisfaction and completeness rather than methamphetamine, crack, fentanyl, and extremely powerful, powerful drugs. And it should be said that some of these most powerful drugs that we're treating now can take that person with minuscule genetic expression and bring them out pretty quickly. They're very, very, very difficult to treat. I say this as a family lecture. We do it for the family program, and we usually ask the family, why is the family so affected by this disease? Well, that's the problem with this disease, isn't it? It does take prisoners. It does take hostages, because the alcoholic and the addict will violate so many boundaries to get his or her drug of choice. Now, you know that the way this should be, survival here should be that oneness with your spiritual power, your God, that wholeness that we're talking about. But if survival was mixed up for this person with their drug of choice, and that became their survival mechanism, take a look at just what, like the rat in the cage, they will step over and climb over in order to get to that drug of choice. Marriages and jobs, family, neglecting their old religious or spiritual beliefs, and of course, major, major detriment to their health. People will use, despite all of these adverse events in their lives and personal health consequences. And it's for that reason that we treat the family. They are victims of this disease. We always like to say, and this is being filmed for the family program as well, that, you know, family members aren't here to get their alcoholic or their addict better. That's our job and their job. They're here to recognize that this disease has affected them and that they need to take advantage of the treatment we offer. That first starts with recognition of the disease and its action in their lives. Any questions?
I'm watching this, and we always talk, I talk to the patients about NIDA doing the study that the longer they're in treatment, the better. And I guess this is more of a comment, but it takes time for the patient or the addict to have that line adjusted. Like 30 days is not necessarily long enough for them to have a more normal, less addiction-based reaction to stress. You know, 30 days doesn't, I mean, in my own life, with my own addiction, I'm watching this and thinking, it takes a long time for me to have a desire to have a more normal reaction to just the little stressful things that go on in my day. That 30 days is